Welcome to Project Firstline for Environmental Services. This module will explore environmental cleaning and disinfection. In this presentation, we are going to focus on environmental cleaning and disinfection. We'll start with a discussion of what it means to recognize the risks and reservoirs that are found in a patient's room. Then, we'll explore cleaning and disinfection practices, as well as the recommended workflow for EVS staff. We'll then end with scenarios to apply what we learn. As we begin our discussion on environmental cleaning and disinfection, we first want to discuss what it means to recognize a risk. Recognizing risk is seeing the potential for a problem to happen, but also acting on it. In healthcare, it's important to recognize the risks of germs spreading to vulnerable patients and residents that have a weak immune system or are already sick. To control the spread of germs, there are certain actions that you can take. For example, cleaning your hands before entering a patient's room, wearing protective equipment when necessary, and regularly cleaning and disinfecting surfaces that are frequently touched, such as door handles and light switches. It's very important to pay attention to your surroundings and ask yourself questions to assess the potential risks. Now, let's take a look at how we can recognize risks when we are going into a patient's or resident's room. Let's review some of the questions that you can ask yourself before stepping into a patient's or resident's room, questions to ask while you are in the room, and questions that you can ask before leaving the room. We'll start with the first section, before going into a room. Questions that you can ask include, is this a routine or terminal cleaning? Do I have all of the appropriate equipment and supplies? Do I need to wear any additional personal protective equipment? Once you've gathered the appropriate cleaning supplies and products and you've selected your PPE, you can step into the room. Again, some important questions to ask yourself here include, what is the dirtiest area of this room? What and where are the high-touch areas? Next, before leaving the room, some important questions to ask yourself would include, has everything in the room been cleaned? Do other staff or managers need to be informed of any issues that I've identified? By identifying and recognizing risks, you can prevent the spread of germs that could affect a patient's health and well-being. As we begin to explore the idea of recognizing risks in healthcare, it's important to think about the moments throughout your workday where there is an opportunity for germs to spread. To recognize this opportunity, we need to know the reservoirs. Reservoirs are the places in the environment where germs live. In this next section, we will discuss the types of surfaces and items that you'll encounter and how we can prioritize patient care areas. Here are the 8 reservoirs where germs live in healthcare. In the human body, we have skin, the gastrointestinal system or gut, the respiratory system, and blood. In the healthcare environment, we have water and wet surfaces, dry surfaces, dirt and dust, and devices. When you understand where germs are found and how they can be moved to places where they can cause harm, you can recognize when they can spread and decide what you can do to protect yourself, colleagues, and patients or residents. Germs can be found in other places, but these 8 are central to understanding and recognizing the risk for infections to spread in the healthcare setting. In most cases, there are 4 main pathways for germs to spread from reservoirs in healthcare. The first is through touch. That usually involves the skin, especially the hands, but it also happens with devices, which touch different people and many surfaces. Another pathway for germs is through breathing in. A third is through splashes or sprays of blood, body fluid, or water from a sink or other source. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or a break in their skin and cause infection. The last common pathway for germ spread in healthcare is through clinical care tasks that bypass or break down the body's natural defenses, like when a patient's skin has to be broken to insert an IV. That creates a pathway for germs to enter the patient's body. When we think about where germs live in the healthcare environment, we think of reservoirs, such as wet and dry surfaces, devices, and items. These aren't the only places where you can find germs, but we focus on them because they have high numbers of germs and levels of contamination. There are three types of surfaces that are important reservoirs for germs. They are shared medical equipment, dedicated medical equipment, and high-touch surfaces. We'll begin with the first column. Shared medical equipment includes items that are used by many workers and patients throughout the day. Some examples include the vital signs cart and wheelchairs. These items should be cleaned after each patient use, which is usually done by nursing personnel. Next, we have dedicated medical equipment. These items are used by one patient, often, and for long periods of time. Examples include beds, bed rails, bed linen, IV poles, and bedside tables. Because these items are in close and prolonged contact with a patient, they can be highly contaminated and should be cleaned daily. Next, we have high-touch surfaces. High-touch surfaces include areas and objects that are frequently touched by healthcare workers, patients, and visitors. This can include doorknobs, sink faucets, toilet flush handles, bed rails, call buttons, and tables, just to list a few. High-touch surfaces should be cleaned daily. It's important to understand that surfaces and items contain many germs that can easily spread throughout the environment. Let's move on to an exercise so we can take a closer look at these different surfaces that we encounter every day. We'll now work together to find and discuss some examples of high-touch surfaces or items. Remember, high-touch surfaces are typically touched multiple times by multiple people. Take a look at this image and identify the surfaces or items that are frequently touched. Pause the video here to give yourself some time to come up with some answers before continuing. We've highlighted some of the high-touch surfaces so you can see just how easy it is for germs to spread. In this image, we can assume that the hospital worker touched the door handle when stepping into the patient's room. Once inside, she touched the tabletop, the vital signs machine, monitor, the IV pole, and the bed rail. She then touched the sink handles to wash her hands before leaving the room. In total, she's touched at least 7 different surfaces in just a matter of seconds. This image shows us just how easy it is to spread germs by touching different surfaces, and why it is so important to clean and disinfect them appropriately. Cleaning and disinfection. Let's now talk about the differences between the two and how we use certain products to accomplish both cleaning and disinfection together. What is cleaning and what does it look like? The purpose of cleaning is to remove dirt and organic matter from surfaces using soap, detergents, or enzymatic cleaners. If we look closely at the image, we can see that a tabletop has blood on it. You can judge just by looking at the tabletop that it is dirty and needs to be cleaned. We first clean surfaces that have dirt or organic matter, such as blood, before we can move on to disinfection. Let's move on to the second step. As we look at the image, can we assume that the room is free of germs? The answer is no. While the room looks to be tidy and clean, we cannot assume that it's been properly disinfected just by looking at it. So, what is disinfection? Disinfection kills most viruses and bacteria on surfaces using chemicals including quaternary ammonium compounds, alcohol, chlorine, hydrogen peroxide, and peracetic acid. It's important to note that this is not an all-inclusive list of products. There are many more EPA-registered products that are designed for a specific purpose. Typically, we can achieve cleaning and disinfection by using a one-step disinfectant, which is meant to both clean and disinfect in a single application. We can use a one-step product for environmental cleaning, except on spills of blood or body fluids. This image is a great example of where it would be appropriate to use a one-step disinfectant. It's also important to know that some disinfectants are strong enough to kill bacterial spores. Bacterial spores are a harmful, tough form of bacteria that can survive for a very long time on surfaces and are very difficult to kill. A common instance of bacterial spores in the healthcare setting is C. diff. These spores can only be killed with strong disinfectants. It's important to always check the disinfectant label to ensure that the product you're using is effective against the particular germs that you are dealing with, such as C. diff. We will now focus on putting together a cleaning cart with the tools and supplies needed to do your part in infection control. When setting up your cart, it's important to plan ahead to make sure that you have enough product and proper supplies for all types of surfaces and all types of rooms. Here's a checklist of the recommended supplies and equipment that you should have with you. If you are going to perform surface cleaning, such as floors, countertops, or restrooms, you will need to have the correct cleaning and disinfection solutions. Make sure your solutions are properly labeled and dated. If you will be preparing a large batch of cleaning solution, then you will need portable containers that are labeled with the solution that it contains. It's also important to never refill or top off a solution. If more is required, replace the used solution with a fresh, unused product. Next, you'll want to have surface cleaning cloths and mops. These can be cotton, microfiber, or disposable cloths. You'll also need microfiber dusting tools with long handles. It's important that when using a cotton cleaning cloth that you do not leave the cloth sitting in a quaternary solution. The cotton is capable of absorbing the active ingredients in the solution, which can make the cleaning solution less effective. Moving down our checklist, you'll need dry goods such as paper towels and toilet paper. Buckets are important for collecting soiled items such as dirty cleaning cloths. Toilet brushes should be kept at the bottom of the cart and away from other equipment to avoid spreading germs. Follow your facility's policies for cleaning and replacing dirty toilet brushes. You'll also need to have the appropriate personal protective equipment ready. Last on our list is a wet floor sign or a caution sign to warn others of any wet surfaces. As we summarize our best practices for our EVS carts, It's important to remember that we always want to plan ahead. This will save you time, and cleaning and disinfection will be more effective. If you do need to prepare any products, this needs to be done in the designated EVS preparation area. This includes making sure products and solutions are labeled and diluted if needed. Safety data sheets, or SDS for short, should be displayed wherever products are stored and prepared in your facility. The SDS includes important information on a product's chemicals, health and environmental hazards, protective measures, and safety precautions, such as handling, storing, and transporting the product. When you grab your cart at the start of your shift, this is a great time to think about potential risks and ask yourself, are my supplies well maintained, dry, and clean for me to use, or are they not usable anymore? Other best practices include separating clean and soiled items to avoid cross-contamination, never putting personal items such as food or drinks on the cleaning cart. We always want to make sure that we rinse our buckets and containers anytime that we change the cleaning solution or whenever we're done using it. Remember to store wet buckets upside down to allow for complete drying. Dry items should always be stored on top of the cart. Liquid products should be kept on the bottom of the cart, where they can be locked and secured. By following these best practices, you will prevent the spread of germs and you will be able to keep patients and residents safe from infections. Now that we know how to think carefully about the environment and the patient care areas that are cleaned and disinfected, let's explore the different types of cleaning that are performed by EVS staff. There are three types of cleanings required for general patient areas, which are scheduled, routine, and terminal cleaning. We'll discuss each in detail, starting with the scheduled cleaning. The goal of a scheduled cleaning is to reduce visible dust, dirt, spills, and smears on low-touch items and surfaces. This is typically done weekly or monthly. Some examples of surfaces that require weekly cleaning include the insides of cupboards, vents, walls, and ceilings. Moving on, we have a routine or a regular cleaning, which is done at least once daily or every 24 hours. The purpose is to remove and kill germs with a focus on the high-touch surfaces. Some examples include the hand-washing sink, bed rails, bedside tables, doorknobs, call lights, sink handles, and light switches. Last, we have a terminal, or also known as a discharge cleaning. This type of cleaning is performed when the patient is discharged or transferred with the goal of removing and killing any germs that may be in the room for the next patient. This type of cleaning focuses on all items that have been shared or touched during patient care and items that are often touched directly by the patient. Now that we have a better understanding of the different types of cleanings, let's talk about what the cleaning workflow should look like. When planning which room to clean first, it's important to remember this order to minimize cross-contamination and stop the spread of germs. We start with the protective environment rooms, followed by standard precautions rooms, then transmission-based precaution rooms last. The protective environment rooms house patients with weak immune systems. Patients assigned to these rooms might have undergone a surgery, or they may be receiving treatment that makes them vulnerable to harmful germs. Next are standard precaution rooms. Standard precautions rooms can also be described as a regular patient room where there are no special restrictions. Transmission-based precaution rooms are rooms with patients who have or are suspected of having an infection. Let's take a closer look at the cleaning workflow for these rooms. In healthcare, it's important to clean in a systematic manner, which means you follow a particular order or plan of doing things. Here are 3 workflow principles to keep in mind when cleaning and disinfecting. The first workflow principle is to always start with cleaner areas and gradually move to dirtier areas to prevent the spread of dirt and germs. The next workflow principle is to always clean from top to bottom or high to low to prevent dirt and germs from dripping or falling and contaminating the clean areas below. For example, you want to clean first tabletops before cleaning the floor. Last, always move in one direction, such as left to right or right to left, to avoid missing areas or contaminating other surfaces and items. An important practice to carry out when cleaning surfaces is following the fold method to maximize all clean sides of a cleaning cloth. This is done by folding the cloth in half, then in half again to create 8 sides. Once you've cleaned a surface, open or unfold the cloth to expose the clean side and resume cleaning. To protect yourself and to prevent germs from spreading to the surrounding environment, we follow the techniques listed here. First, always make sure that you've cleaned your hands thoroughly before putting on gloves. Next, remove trash and soiled items from the room. Remember, trash and soiled items are reservoirs for germs that can easily spread. Next, after handling trash and soiled items, remove and throw away your used gloves. Then, clean your hands. Next, put on a fresh new pair of gloves. With your new pair of gloves on, you can proceed to cleaning and disinfecting surfaces. When finished, look around the room to see if there are any issues that need to be addressed, such as leaking faucets. Last, remove your gloves and clean your hands. Moving on, we'll now look at the information that we can expect to find on a disinfectant label. Here are the 5 things that we want to look for on a disinfectant label. We first want to make sure that the disinfectant is an EPA registered product, as this ensures that it meets regulation standards. Next, we want to make sure that the product can be used on the surface that you intend to disinfect. Using a disinfectant on a surface that the product is not intended for can cause damage to the surface or item, which poses a risk to human and environmental health. Then, we want to make sure that we know if the disinfectant is effective at killing the germs we are wanting to eliminate. Earlier, we mentioned that certain disinfectants can kill bacterial spores, such as C. diff. The label will let us know what the disinfectant is proven to be effective against. Some products may require dilution before application. If there are dilution instructions on the label, make sure that they are followed to ensure that the product is effective. This might be done by your supervisor or manager. The last and very important piece of information to look for is the contact time, which can also be called dwell time. The contact time means the amount of time a disinfectant needs to stay wet on a surface to work properly. When you use a disinfectant to clean a surface, it needs a little while to effectively kill the germs. For example, if you are using a product that notes a contact time of 5 minutes, then the surface that the disinfectant has been applied to must remain wet for those 5 minutes in order for it to work. If you wipe away the solution too soon, or if you fan or blow on it to make it dry faster, the product will not work well enough to get rid of the germs. It's important to follow the product's instructions and recommended contact time to make sure things are thoroughly disinfected. Now that we've discussed cleaning and disinfection in detail, we will now look at scenario examples together to determine the best approach for infection control practices. Here is our first scenario. You are going into a standard precaution room where you will be performing a routine cleaning. Before stepping into the room, here are some questions to ask. What are the standard precautions? What type of personal protective equipment do I need to wear? What if the patient or resident is in the room? Do I need to do anything differently? Do I have all the appropriate cleaning products and equipment ready? What are the workflow principles that I will follow? Is there anything in the room that might prohibit me from cleaning high-touch surfaces? And what surfaces am I responsible for cleaning and disinfecting? Let's now take some time to think of the questions to ask while we are in the room. Questions include, have I identified all high-touch surfaces and items? Do any surfaces need to be cleaned before it can be disinfected? Have I followed the workflow principles? Remember, recognizing risks means identifying where germs live in the environment. Areas such as sinks and bathrooms are frequently wet and can be a common area for germs, while dry surfaces such as bed rails, countertops, and doorknobs are frequently touched by multiple people. We want to pay special attention to the different reservoirs when performing a cleaning and disinfection. Let's now move on and think of the steps to take before leaving the room. We have finished cleaning the room and we are ready to move to the next area. Before stepping out of this room, what are some questions that we want to ask? Questions include, are there any other potential risks in the room that I need to address? Do other staff or managers need to be involved? Have I looked around the room to identify any issues that may present a health or safety risk? Remember, there are a number of things that need to be done before stepping out of the room. Once you have finished your task, it's important that you always clean your hands before leaving the room to avoid spreading germs. Here is our next scenario. For this scenario, you are going into a C. diff room to perform a routine cleaning. Before stepping into the room, let's review some of the questions to ask. Questions can include, what type of precaution is being enforced? And what type of PPE do I need to wear? Do I have the appropriate cleaning products and disinfectants? Remember, specific disinfectants are needed to kill certain types of germs, such as C. diff. And is there anything in the room that might prevent me from cleaning high-touch surfaces? The difference in this room type from the previous scenario is that you need to pay attention to the PPE that you are selecting and making sure that you have the products that are specific to the germ you are trying to get rid of, C. diff in this example. Now that we are in the room, let's take some time to think of the questions that we want to ask. Questions can include, have I identified all high-touch surfaces and items? Do any surfaces need to be cleaned before being disinfected? Am I following the proper workflow principles? And what are some of the potential reservoirs? Remember, we want to think of the reservoirs that can be found in the room, such as door handles, light switches, bed rails, and tabletops. Now that we finished cleaning the room and we're ready to move to a different area, let's review some of the questions that we want to ask. Questions can include, are there any other potential risks in this room? Do other staff or managers need to be involved? Before leaving the room, we want to make sure that we take a look around to identify any health or safety issues. And upon exiting, we want to follow proper hand hygiene. Let's take a look at our key takeaways from this presentation. Remember, it's important to pay attention to your surroundings and ask yourself questions to assess potential risks. Proper cleaning and disinfection are very important for reducing the spread of germs and preventing infections. Following the cleaning and disinfection workflow principles helps reduce cross-contamination. This means starting in the cleaner areas and moving your way toward the dirtier areas. And last, understanding a disinfectant label is important because it provides information on how to properly use a product. Using the disinfectant as instructed is important for killing germs and preventing the spread of infections. You can keep exploring these topics on your own using the resources found on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.